Hello, good evening. Welcome you to my small videos on the clinical experience series. So today I am going to discuss about a case scenario of the atropine psychosis that I encountered yesterday. So the case was of organophosphate poisoning. So there was an injection of the insecticides, and then the organophosphate poisoning was treated as per the protocol. So initially we did the gastric lavage, and after completing and simultaneously we gave the atropine to the patient. So initially 2 ml of the atropine was administered to the patient, and then after we look at the signs of the atropinization and tachycardia and monitor, and then gradually the dose of the atropine was increased to the patient, and all the treatment was simultaneously ongoing. And after administering the 10 mg of the atropine to the patient suddenly developed excitations and hallucinations and delirium kind of thing. And then after I monitor all the signs of the atropine overdose, like whether there is mydrosis or not, is there any signs of any cycloplegia, or is there other features of like respiratory decreased secretions of the respiratoriness, increased temperature of the body. So the main prominent feature that I encountered was the CNS excitement, delirium, and the hallucination. So I made the diagnosis of the atropine psychosis. But what happens in case of atropine psychosis while managing the case of the organophosphate poisoning is that patient party used to get irritated and used to get terrified with the ongoing treatment, and all of the sudden their expression both changes. So I counsel the patient party that this is due to the overdose of the atropine, but this is what we do as per the protocol in case of the organophosphate poisoning. And so I gave haloperidol, and then after later on I doubled the dose of the haloperidol, and the haloperidol of 0.5 mg was given to the patient, and then the patient eventually calms, and after 2 hours the symptoms subsided, and then there was vitals stable and everything went well. So let me discuss something about atropine psychosis. So atropine psychosis is something that we used to encounter in case of the organophosphate poisoning where we give the overdose of the atropine. So we can say this is a kind of atropine overdose, atropine toxicity, or we can also say this is atropine poisoning after the OP poisoning. So in this case we see all the features of the atropine overdose. And in case of organophosphate poisoning, when there is, especially after giving the atropine, when the CNS symptoms comes, then the atropine psychosis diagnosis used to get made. And the treatment for the atropine psychosis, when there is extreme toxicity, I suggest to go with the physiostigmine 1 to 4 mg according to the clinical scenario. But if physiostigmine is not available, then you can treat it with antipsychotics or antidepressants. So I have been given haloperidol and symptoms got controlled. So most of the time symptoms used to get control over hours, but sometimes it may take days. So thank you, hope you got some basic idea about the atropine psychosis. See you in my next video on the clinical experience series. Thank you.